Good morning. I'm Amresh Tiwari, editor publisher Double Helical. This is being published from Delhi NCR region. Today it's a very hot topic. This is integrated medicine. I know that this is one of the favorite topic of Dr. Agarwal. And today I'm very grateful to announce today we have a lot of eminent speakers like Dr. Gyani, he's a quality man of India, and also Director General of Association of Healthcare Providers India. Dr. Amitabh Banerjee, he is a Professor Emeritus at DY Particle Medical College, Pune. And Dr. R.K. Tuli is also known as a holistic medicine. It means father of holistic medicine. And Dr. Iswara Reddy, former director, Indian Institute, Morarji Desai Institute of National Institute of Yoga. And Dr. H.P. Singh, he is a senior child specialist. And one of the most eminent person, Dr. Tanuja M. Nesari, she is a director, All India Institute of Ayurveda, and Dr. A.K. Agarwal. He is a very eminent personality in the medical fraternity. He is also our advisory board committee chairman, and former dean of Maulana Azad Medical College, and presently advisor clinical and innovation research, Apollo Group of Hospital. I just request to Dr. Agarwal, please moderate today's webinar, and topic is this is a integrated medicine. Thank you. Hand over to Dr. Agarwal.
Good morning, Tiwari ji. Good morning, all my colleagues. It's a wonderful morning and a wonderful topic. Let me again let you know that Double Helical is a medical magazine which is perhaps for last 10 years bringing all the relevant topics which are useful not only for medical fraternity but for the society. And I'm thankful to Mr. Tiwari for bringing out and targeting different topics through the experts all over India. And this time, it is the integrated medicine. Integrated medicine is a very valid and viable subject as regards India is concerned. Of course, it is viable in the entire globe, and the entire globe is looking towards it. Why I talk about India? Because India has got a very rich heritage culture. And we were into the science of medical treatment even 1,000 or more than 2,000 years before, and we had our own methodology and our own way of treatment. But when we came down to 17th century, and there came the system with the modern system of medicine, but in between, India had developed Ayurveda, Unani, and of course, disciplines like yoga and naturopathy, homeopathy, also were existing before and they are existing now. Now, as the word indicate, integrated. Integration means we are targeting towards the benefit of the patient who has come to us with some expectations, with expectation that my doctor will look after me in, if not totality, at least to the maximum possible. Of course, according to his expectation, he may think 100%. And why not? If we are able to give 100%, we should give. But I always feel there is nothing like 100%, but maximum possible, whatever we can do. So with this concept, all system of medicines are very good in certain areas, but perhaps they may not be having that strength. And where other systems are very powerful. So it's the integration of different systems where in the best interest of the patient, two different groups should sit together and decide then what sort of treatment this patient deserves. That is what, from my angle or from layman's angle, the definition is, though there are many technical definitions given to integrated medicine. I would like to request my friend, my colleague, Dr. Amitav Banerjee, who is Professor Emeritus from D.Y. Patil, Pune, a very eminent place, to give his views about the integrated medicine, and where Dr. Amitav will like to take over.
Yeah, thank you, Professor Agarwal. It's a pleasure to come on this platform of Double Helical. And as you rightly said, we had a very old culture of healing and curing and caring also. And we had perfected the art of medicine. Medicine is the oldest art and it is the newest science. And after, rightly, as you said, after the 17th, 18th century, the scientific or modern medicine gave it a added A of a science, which is the newest science, but the oldest art. So in our eagerness, we are rapidly making technological developments and specialization and subspecialization, which is a good thing. But we are actually solving the patient's problem in piecemeal, not as a holistic. So this ancient systems of medicine like Ayurveda and other systems, they have this holistic approach to the patient's diet, lifestyle, environment, which of course the modern medicine practitioners also lay stress right from the times of Hippocrates. And even today, those who are good modern medical practitioners, they also stress first on lifestyle, diet, physical activity, and then pharmacological intervention. And particularly chronic diseases like diabetes, obesity related, coronary heart disease, even some cancers can be can be coped, can be treated with lifestyle and then intervention with drugs. And if you have a good lifestyle, unfortunately, the modern medicine is stressing too much on technological advances and the same other limitation of ancient systems like Ayurveda are that they are not adopting good research. And if these two systems come together and as a team, if they practice, there are a lot of potential for Ayurvedic drugs also to find place in modern medicine. And we have an example from China in 2015, the scientist who found out the benefit of Artemisia in malaria got the Nobel Prize. So in Ayurveda also we have a large treasure of herbs and other products which have not been researched, and now I think there are a lot of institutions in India which is doing the research. So integration should be at the research level, and integration can also be at the practice level in a day-to-day practice, like the history taking, the talking to the patient, counseling the patient on lifestyle. 90% of this lifestyle and physical activity are common interface between modern medicine and Ayurveda. There should not be any compartmentalization. So the patient can be first counseled, pre-treatment counseling, post-treatment counseling can be by the holistic systems of practitioners, and if they work together, they will learn from each other. I think there's a lot of scope. So that's all I have to say. Thank you. So muted as well.
Thank you, Dr. Banerjee. And I think you have very nicely explained that why we should go into integrated medicine. And if I try to say that if the question asks who will go for integrated medicine, don't you think India is the first country, because India is very rich as regards our ancient science is concerned.
Definitely, sir. We have got.
We have a history of more than 1,000, 2,000 years back. And of course, you rightly said that we have to create more and more evidences, but don't forget the perception is very strong. And sometimes perception is also very important when we talk about treating a patient, because people are having their own personal experience. So to continue the dialogue, I think now we will like to request is Dr. Tanuja Neshri there? Okay. I'm sure she will be joining soon, but now we have Dr. Ishwara Basavreddy, who had been the former director of Morarji Desai National Institute of Yoga, New Delhi. You must have seen this, a wonderful institute, and perhaps in the field of yoga, this is the center of excellence for the country. We are lucky to have you, Dr. Basu Reddy. Will you like to comment upon the role of yoga and your personal opinion regarding integrated medicine?
Pranams to you all, respected Agarwal ji and Tiwari ji, and I found many friends like Dr. Tuli and others. Very happy to meet you after a long time. Uh, First of all, thanks for inviting me, and it's a wonderful topic. From last nearly 5 years or more, we are talking very strongly about integrative medicine. Integrated medicine. It is the future now, and government has taken several steps to integrate, but it takes time. It takes a generation to make it meaningful. Because understanding each systems and coordinating it takes time. That initial procedure has been started a decade back. It is initiated now. It is I think so. Still, it is in the baby form, and I do hope that it's grow much stronger in the years to come. This is my opinion. And the second one is regarding yoga. It goes with every system of medicine. So, especially honestly speaking, a lot of research. There are more than 14,000 research papers published in peer-reviewed index journals or in very good journals. I found that most of them have been published by the modern medicine professionals. The research has done by yoga professionals are mostly on the technology, the philosophical dimensions, and the practices, etc. But disease specific and integrative medicines, all these things have been mostly done by the persons who are having a rich medical background, modern medical background. Very few Ayush professionals have joined in recent past to research about the potentials of yoga in the management of various disorders, particularly lifestyle disorders or non-communicable disorders. So I have just 3 minutes, 3 points. First of all,
Please continue. Please continue.
okay, I have 3 points to mention is what is the role of yoga? Many people, I'm not exaggerating because I'm a yoga professionals, but there are some. One is first, it is as a preventive medicine. If you go to the Europe and most of the countries are promoting preventive medicines much stronger. If you go to German and other countries, I found nearly 3.2 to 3.4% of the total budget has been mentioned for the preventive medicine. Yoga is one practice or one system which is very, very good as a total, as a yoga as a total, not only the philosophy, the practice and the technologies mentioned in the ancient texts are very good for the preventive medicine. That's one thing. The second one is when you go to the management of the diseases, it needs support of the eye systems, particularly Ayurveda or Siddha or naturopathy. So I do hope that's because patient is more important when you treat. And particularly modern medicines, whenever they go for any lifestyle disorders, yoga should be integrated. Third one is in the rehabilitation. So especially cardiac rehabilitation, Dr. Manchanda is did a lot of work and others. And even in the COVID time, for COVID rehabilitation and cancer patients, especially after chemo and others, we found it very good. And one dimension where yoga comes for the psychological dimensions, for the depression, anxiety, neuromuscular disorders. So yoga found to be very good. We did a lot of work with the Nimans and Ivas, and we found that especially yoga, medicine is not the solution for the depression and anxiety. Yoga is the ultimate solutions. So why don't we use the strength of yoga, which has been widely researched, and make it quantified by the multi-scientific studies so that it should be accepted by the medical profession, because medical professionals has their own ethics. So they have these things, but when it comes to the yoga, they have to change a little bit to understand the concepts and technology. I use the word technologies of yoga, which is going by three ways. One is body alignment by asanas, and we align the line of gravity, center of gravity, whatever we are finding in different platforms, they are mostly wrong because they are not followed the technology mentioned in the ancient text. B.K.S. Iyengar Guruji has brought this to the West. That's why he become a very popular guru across the globe in the 40s, 1940s and 50s. That's the reason. The second one is breathe is more important. There are several breathing techniques, breathe holding techniques. So to live well and you have to breathe well. So yoga is the best way to manage the breathing. Third one is to mind the management of the mind. It is the meditation. The Western concept of meditation is different, and but yogic concept, there are two systems. One is yoga of Patanjali and yoga of Buddha. They are the widely very scientific procedures of meditation. Whatever we found in the public domain, the meditations are just the Western concept of meditation, but yogic concept of meditations really it is helping to manage the mind. These are the wide, and there are two auxiliaries. One is the detoxification practices, and there are some dietary, different from the naturopathy and Ayurveda. It follows, but different from that one. Yogic concept of diet, it's a holistic and very good. And these are the five dimensions. We can make it a capsule for each disease and each individuals. It differs from individual to individual how you give the modern medicines. The dosage is going to be changed, the same concepts. So likewise, the experts can do that. So if you do that, especially integrating this along with the medicines when you treat the disease, but when it comes to the prevention is the independently it can go. Rehabilitation along with the medication. If we do certain practices, definitely it's going to help. So I conclude with a statement: integrated medicine is the future. Yoga is going to play a big role because it is accepted already widely across the globe by all the systems of medicines. In the ancient systems of Indian medicines like Ayurveda, Siddha, yoga is already a part, integrated. Without yoga, they cannot practice. So that's why with this one, we need the multi-centric studies. The modern medical community should accept it unless it is researched properly. Then there is then it's a big future in the perspective of the patient. Thank you very much for the opportunity.
Thank you, Dr. Ishwar. I think what we could gather that yoga is part of each and every system of the therapy. This is number one. Number two is that by virtue of the keen interest taken by the experts of yoga and the teachers of yoga, a lot of evidences has been created, whether it is in form of wellness yoga or therapeutic yoga or rehab part of the yoga. And obviously, this is a wonderful opportunity to integrate. You have to create awareness among our people that whatever you are prescribing, please do integrate the yogic exercises as per the need, as per the expert advice, that, well, we do need it. And perhaps once you add into it, the outcome for the patient will be definitely more and more beneficial. It's a wonderful piece of knowledge you have given to us, but we'll come back to you with some more queries, I'm sure, from my side also and from everybody else and from the audience too. Now, I think I will like to request Dr. Professor R.K. Tuli Sahab Tuli Saab is a known personality for holistic medicine. And of course, once we talk about holistic medicine, yoga is a very integral part of that. And he had successfully established, he started his career as the holistic medicine in Apollo Hospital, New Delhi, and then he has got his own setup in Soham. And perhaps a number of patients have been benefited. Dr. Tuli, will like to give your views about integrated medicine.
Namaskar. It is really my privilege to be in this august panel. Thanks to Double Helical for giving me this opportunity. And it's really a privilege to be moderated by the most eminent person of medical field, Dr. Professor A.K. Agarwal. Now, having, since I'm called the pioneer of holistic medicine, I would like to give a little background to where does this need arise. See, the world over, in recent decades, the healthcare infrastructure has been largely based upon the modern medicine or the allopathic system of medicine, with World Health Organization as the steering body for all over the world, which defined health as a state of not merely absence of disease, but a state of positive physical, mental, and social well-being. Now, and modern medicine made tremendous strides with the advent of especially antibiotics, vaccinations, diagnostics, and surgical advances, good management of trauma, etc. But then in 1978, WHO launched a program. They thought they had now developed the wherewithal to extend health to everybody, and they launched a project along with UNICEF, what is called the Health for All by 2000 AD. But unfortunately, this program came wanting, and it found that it was not possible with the available model of healthcare. In the meantime, there's been a total shift in the emergence of various diseases which have been overtaken now by the lifestyle oriented or the non-communicable diseases. At the same time, as a result, the effect of antibiotics has significantly reduced because of the non-emergence of drug-resistant microbes. So the whole scene has changed, calling for the WHO that there is a lot of wisdom in the ancient systems. And as Dr. Baswareddy, Dr. Agarwal, and even Dr. Amitabh have already said, that we have a rich heritage of right from our Sanatan in the form of Atharveda, etc., and very nicely brief, very widely described by in Charaka Samhita and the Yoga Sutras of Patanjali. And if we incorporate that, see, basically, now when we start talking of the integration, so now the World Health Organization says there should be an integration of all the systems of health, because no one system of medicine is perfect. Even though the healthcare, like in our country, 95% of our budget is dedicated to the Ministry of Health and Family Welfare, regulating the healthcare infrastructure in the country, essentially on the basis of modern medicine. And a very small percentage is given to the Ayush department, which has so much of rich heritage. Now, for example, it is the Charaka Samhita which gives us the dimension of health, that human being is not only a physical, mental, and social well-being, but at the core, human being is a soul or a spirit. And so much that in 1986, at the behest of the then Director General Health Services of India, the World Health Assembly passed a resolution that spiritual dimension should be added to the dimension of physical, mental, emotional, and social and spiritual health. But since the word spiritual is not understandable by the modern science, it has not been implemented into the mainstream medicine, or it has not been given a, because it is beyond the realm and the thinking of the concept of modern science. Though right from the ancient times, even father of Hippocrates was aware when he said that the greatest factor that determines our health is the life force in each individual. Then the scientist Einstein, our country, the greatest scientist, President APJ Abdul Kalam, all have said that science without spirituality is lame. So we must, and human being is at the core, is a spiritual being. And the whole concept of our Ayurveda, which deals with Veda, means the knowledge of the life, and Yoga. Yoga is the union of the Antaratma with the Paramatma. It remains that harmony. And that's where the Patanjali Sutras describe yoga to be Ashtanga. I will like to definitely emphasize here that yes, yoga is very important in its physical forms of various asanas, pranayam, dhyana, etc. But the yoga begins in the yam and niyam. Is your thought, is your actions, is your deeds that determine you. And just because I am not born with a very flexible body, I cannot do the asanas, it doesn't mean that I cannot be a yogi. And as a matter of fact, I tell all my patients, because these days everybody says, I do yoga for half an hour, 1 hour every day. I said, just doing yoga is not enough. Adopt yoga as a lifestyle. Be a yogi. Yogi in action. You want to be a Karam yogi, Dharma yogi, Raj Yoga, whatever you want to pursue. Be in yoga, be in this action, that whatever I do is for the benefit of humanity, for the benefit of others. Now, the problem comes is that people think of a doctor or a medical or a help only when they come into emergency. You tell them as much, or they know, but they do not find time to take care of their health. As Dr. Baswareddy is very well said, that it works at all the levels, because by regulating the mind, it regulates all my internal organs. The autonomic nervous system is regulated by the yogic practices. Thereby, my body alignment, my breath, my focus on life, etc. So, and the advantage is, when we talk of integration, we cannot integrate drug-based systems. Now, for example, there's been a lot of controversy by the respective medical councils that how can we integrate? If a sick person cannot be given medicines from different systems of medicine. Well, one can choose Ayurveda, homeopathy, or Unani, or Siddha as per one's choice to keep himself well as a preventive or a early stage of the treatment. But when the problem becomes advanced, when a problem takes the shape of an emergency, then one has to rush for the tertiary care of our hospitals. Fortunately, in our country, we have a very advanced tertiary care facilities all over, and a lot of people from all over the world even come to these hospitals to avail this facility. But then tertiary care is being overcrowded. The answer doesn't lie. It does address to the emergency. It saves our life. It can mask our symptoms but we cannot cure any disease. So the best thing is we go into the various stages of health. That is primary. I say even before prevention comes this promotion of health. Everybody knows how to improve my health. If I'm on a proactive, that I want to keep on improving my health, automatically I prevent onset of any sickness in my body. And that is where the lifestyle disorders, and here the Ayurvedic wisdom also, one of the best things that any human being can do is to follow the nature, the laws of the nature. And I tell each of my patients early to bed and early to rise. Follow the circadian rhythm. Be the part of the physiology of the nature. We are a product of the nature. Let's be one and in harmony and yoke with the nature. And that begins with what time I go to bed. And so early to bed and early to rise makes, as they say, everyone healthy, wealthy, and wise. So I get up in the morning. Now I have plenty of time. It's the Brahma Muhurat. That's the time when the nature's spiritual energies are at its peak. I merge into that. I draw from that. It elevates me in that state of yoga practices. And the Ashtang, Yam, Niyam, pranayam, asanas, dhyan, dharana, and be in a state of meditative uh, samadhi throughout in one's work. The quality of one's work will improve. And of course, prevention is the best medicine. So that will prevent all diseases, particularly today, all the diseases which are being termed lifestyle disorders, they are all preventable. They're all avoidable. But because of our hold for life, which creates life work imbalances and all the problems, all the diseases, and there is no cure for any disease. That if there is a cure, that is only by restoring our milieu interior, the homeostasis of the individual, which can promote. And here I would like to emphasize a system of Ayurveda, which theoretically is based on yoga, which I call it accelerated yoga or emergency yoga or therapeutic yoga, is the Bhedan Kriya. The Bhedan Kriya, this has been unfortunately neglected. Suchi Veda has been a part of our Ayurvedic heritage, and along with the spread of the Buddhism, it went to China, and there the royalty patronized, and it is being today known as the system of acupuncture all over the world. Now, acupuncture is Vedic, acupuncture is yoga, acupuncture restores the homeostasis. And I tell you, my transformation or my evolution started in the early 80s after having been a very good, competent medical physician for nearly 15 years, when I found that an acupuncture needle could handle an emergency faster than parental administrations. And that's what empowered me to think that why can't I be a better doctor by integrating this into my practice. And there the evolution started, and today I am a total bhakt of our Vedic wisdom, which may come in the names of Ayurveda, which may come in the name of yoga, but these drug-free modalities can be complemented with all the drug-based systems. They take modern medicine to another height. And in emergencies, it works, it complements to save lives and cut down the sickness, help real-time cure from, like I have a series of videos on YouTube saying that from incurable sickness to total wellness, body, mind, and soul.
Dr. Tuli?
Yes, sir.
No, please. I think
Okay.
you have given us very, very important information at a holistic approach, and you yourself, in an example, being the postgraduate doctor from army background, and then one day you decided, let me also look into the holistic aspect, and you have become a success story, not only, I mean, for many people who have been benefited by you. Sorry, we have to move on to next speaker because now we are running short of time. Is it okay? We'll
I'd
come back to
almost
you.
completed. Yes, sir.
Yeah.
I'd already completed
Thank you.
what I wanted.
I think now we have been joined before I switch over, but now we have seen Dr. Tanuja Nestri. Dr. Tanuja, are you with us?
Can I
Yes.
hear you, sir? Yeah, namaste.
Yes.
Pranam.
Namaskar, Tanuja
Yeah.
ji. All of you
Namaskar.
know Dr. Tanuja Nestri. She is the Director of All India Institute of Ayurveda. She is the advisor to the Ministry of Ayush. And let me tell you, as per my personal interaction, she and her team is creating such a revolution as regard the Ayurveda's evidence-based science. I must appreciate your system, Tanuja ji, that you are perhaps, we understand Ayurveda for a number of years, but at the same time, everybody demands evidences, and that is what you and your system are doing it. And my personal visit to your institution has proved that, yes, we are also evidence-based. And after Tanujaji, I will request my friend Dr. Gyani, and we have a very important guest, commentator, Dr. Achal Gulati, Vice Chancellor of Mahatma Gandhi University. Please stay on. And Dr. Tanuja, give your
Uh,
view.
Yeah, pranam, sir, and thank you very much. I feel blessed, honored to have been given this opportunity to share my views before all the eminent leaders in the integrative medicine. And I really feel humbled. Agrawal, sir, you are our mentor, guide, and the strong supporter to integrative medicine and to Ayurveda and its integration with science, technology, and conventional medicine. Am I audible, sir?
Yes, yes, very well.
Okay, okay. Thank you, sir. Thank you. So I am representing the All India Institute of Ayurveda, which is aims for Ayurveda and Tertiary Care Hospital Postgraduate Research and Training Center established under Ministry of Ayush as aims for Ayurveda. And this has been envisioned by Prime Minister, then uh, Vajpayee ji, and then present government to have one center which is a true integration with the not only conventional medicine but with the science and technology. So in the bylaws cabinet note itself, it has been mentioned that there should be an institution to showcase our traditional soft strength and our strength to create an evidence to our traditional wisdom, which can be classical yet contemporary. So it was envisioned to have the tradition supported with the technology. So it has been mentioned that there should be institution in line with AIMS, All India Institute of Medical Sciences, IIT Delhi, and Indian Institute of Sciences, Bangalore. So this integration I consider, and we are trying to establish with conventional medicine, with the science, and with the technology. So I will cover within 3-4 minutes these aspects. What are the models we have created? So at All India Institute of Ayurveda, which is we have created holistic and integration. So holistic in the sense, it is a panchakarma, diet, lifestyle, oral medicine, or dawa and dua, care and with the compassion, and care and cure model with the holistic Ayurveda principle, holistic whole system therapy or treatment. But it is supported, integration, it means it is supported with all the diagnostic measures, pre and post, biomedical tools for investigation, diagnostics, including radiology, CT, biochemistry, and all radiological and laboratory investigation. That gives us a strength, confidence, and also to the patient to use the holistic, to utilize, to have the benefit of the holistic. For example, this holistic science of Ayurveda, which is the science of knowledge system of not only health but happiness. So what we say that our tagline is from illness to wellness to happiness. So patients are completely not, we can say, cured, but managed with the holistic and integration with the technology. So we have, since last 6 years, since its inception, we have the data, created the data, and everything is HMI, supported with the documentation and data. So this is how practice-based evidence has been created. So 2.7 million, 27 lakh patients data we have. If you ask us how many patients you have treated with diabetes, then I can say that I have a data of 51,000 patients supported with HbA1c and other parameters which the conventional medicine and the entire world wants. Similarly, during COVID also, we had all the markers, internationally accepted markers, but there was no mortality and mean recovery time was reduced to 50%. And the world wants evidence in terms of the publication. So all these have the publications in the scientific peer-reviewed journal. So this is a model of practice-based evidence in tertiary care setup of Ayurveda. At the same time, we have where the 97 to 98% of the medicine is given with the Ayurveda, holistic Ayurveda. But since this integration is a patient-centric integration, we also have a co-location of conventional medical doctors, allopathy doctors in every specialty, because we have 46 specialties established as a holistic. So we have diabetics, we have gynecology, radiology, ENT, ophthalmology, pediatrician. So these 46 departments, we have co-location of conventional doctor. We have ICU, NICU as well. So this is a model where 3%, 4% when a referral is required in the emergency care, in the acute management, in the surgery, we have the co-location. So this is a co-management, co-location and the co-management. So in integration with the conventional, we have co-location. We have the scientist also. At Sabdarjung, we have another model, health and wellness center, where we have allopathy hospital, 25,000, but we have our health and wellness center and Panchakarma clinic, 1 to 2%, which is required for the patient at Sabdarjung. They do not have to come to Ayurveda, but there it is co-location. We also have models at wellness model where at Labasna, Masuri, Supreme Court, Statue of Unity. Everywhere we have the Heal in India, Heal by India. So wellness model where it is integrated. With the science and technology, we have our collaboration with IIT Delhi and CSIR laboratories, where we have technologies developed for Ayurveda biomedical instrumentation, IT platforms, and also with the NIPTM, that food and the food technology, that there is an integration with the dietetics and the pharmacy, drug development with DIPSERV. So these are some of the integration with the science, and with 1500 publications, we can say that we are now adopting practice-based evidence to evidence-based practices. And I'll just conclude with saying that latest development and the science tells it is like disruptive technology. So we have artificial intelligence, ML, AI, ML. So now we are developing with WHO that AI policy in traditional medicine, that is artificial intelligence policy for traditional medicine, and that would be launched soon by both dignitaries, political and topmost dignitaries from WHO and Ministry of Ayush at GTCM, Global Center of Traditional Medicine. So this integration with the science, technology and conventional medicine, I think it is the way future. That's what we are trying to create. And thank you very much, sir, for all your support and the guidance. And we
Thank you,
really are, and we have with the yoga also, as Basav Reddy is there. So yoga and Ayurveda, two sides of a single coin. So within system Ayush, we have also integration. So thank you, sir. Namaste.
Thank you, Tanujaji. I agree in totality. During COVID, I myself witnessed the outcome of your institute, and you have had so many thousand patients suffering with COVID and not a single mortality, not a single mortality. So that's out of strength, and
thank you.
Giving your examples where you have integrated the doctors from modern system, the diagnostic part of it, and now you are creating an example of true integration as we are talking about. So please, I know you are traveling somewhere, but if you can be with us for some more time. And
sure, sir.
I will request my friend, Dr. Gyani. Dr. Gyani?
Yeah.
Yes, Dr. Gyani, sir. You are the mastermind behind the quality and the patient safety as regards India is concerned, and of course, globally also you have been advising at many places. What do you think when we talk about the integration? Of course, there is no compromise with the patient safety. There is no compromise as the quality parameters. I know it very well that now even Ayurvedic hospitals are going for NABH accreditation and all. And we would like to have your expert opinion about it.
Thank you, Dr. Agrawal. When you referred my work on quality and patient safety, just let me bring out one simple point that when we launched the accreditation for the modern medicine, basically in year 2006, let me, I think, convey to my all panelists here, within next 2 years, NABH came out with the accreditation system for all branches of Ayush. Not only the accreditation standard, but we realized that we did not have the structural, the standard for all these branches, for Unani, Siddha, Homeopathic, Ayurveda, and Yoga. So we brought out another set of documents which brought out the structural requirement for these hospitals, so that the people can be benefited when they are going for accreditation. So I think this is the work we did at that point of time. It really did pick up, I have no doubt, because people naturally kept talking in those days that there is no evidence, or there is no quality, there is no checks on infection in the field of alternative medicine. So I think our set of those documents set the things in the right direction, and I can see the benefit of that happening. That number of Ayurveda, homeopathy, even Unani and Siddha hospitals have gone for NABH accreditation. And with all that experience, just recently on 17th of September, on World Patient Safety Day, NABH brought out a fresh standard which integrated Ayush into one standard, and that was launched on 17th of September. So that much, I think, work has gone into it, which I think gradually will bring Ayush into, I don't want to say it, but actually because it is the perception that is not in the mainstream. I think with this effort, it will come in the mainstream. And the dialogue which Madam Tanuja was talking, I think that is very heartening. That when that level of institute is working on artificial intelligence and machine learning, I think in very next few years, we will be able to generate that confidence in the mind of the people that yes, Ayush, Ayurveda or alternative medicine is also one of the pathy which we can follow. Now coming to very simply on this topic of integrated medicine, I just opened my original book of NABH, that we set up that point of time in the first page itself, the 5 principles. What is the meaning of holistic or integrated care? The first point was that it is the holistic approach to the health. Number 2 was that it provides us really the patient-centric care. We use this word patient-centric care very loosely, but actually in that standard, we specified this very, very boldly, and we elaborated it, what actually the meaning of patient-centric care. Then third point, which just now Madam Tanuja was talking, that evidence-based integration. I think I don't know whether we are all aware about it, that alternative medicine, which we talk, has the history of 3,000 years from now, and followed by work in China, which happened 2005 years. So it is such an old, field of medicine. And only thing is, we were not able to document the way we are doing it with the art of information technology now. But definitely, the hell of a lot of work has gone. And fourth point in our standard was focus on preventive and promotive wellness. I think this is the area where Government of India 2 years back allocated 30,000 crores, and a lot of work is required to be done in that, because we need support of NGOs, local governance body on bringing out sanitation, drinking water, and nutrition. So these three aspects are supposed to be covered. And last one we mentioned was collaboration across all the discipline. And recently we have suggested to the government of India that in the MBBS curriculum, there should be one full paper on alternative medicine. So then only our doctors allopathic doctors will be able to appreciate and refer the patient or take the help of doctors from other discipline or alternate discipline and provide the holistic care. So I think from this point of view, ultimately, which we have been talking long back, that the balance of the mind, body, and spirit can truly come when really we are able to bring the two disciplines together without without being referred to as cross-pathy, but independently. And last, my point is that Ayush Ministry has to very aggressively promote the Ayush discipline rather than talking that it is supporting to the modern medicine. No, by itself we need hell of a lot of promotion, and maybe certain primary health centers could be Ayush, certain primary health center could be homeopathy. So I think then only we'll be able to generate the confidence and also pass on the benefit of this discipline among the community. So thank you very much, Dr. Agrawal.
Thank you, Dr. Gyaniji. I think one thing more which we can expect from you, since you are the driving force amongst the association of all the big hospitals all over India. Can we make it mandatory for each hospital to have some sort of holistic setup where perhaps the patients can be referred and get exposed? I mean,
there are some hospitals have, but I think I will discuss with you separately.
I think this
because I will have a small model, that model, if you are able to define, I'll sit with you.
We will get back to you and we'll talk about the models.
Yeah.
And then you can always integrate it with I think you have 650 hospitals under your jurisdiction.
Yeah.
I think.
Thank you very much.
Thank you. Tiwari ji, is Dr. H.P. Singh there?
You're not available, carry on.
Okay. I think before I proceed further with question answers, we have our expert the dawn of the medical profession, Dr. Achal Gulati, who had been I'm his mentor and he's my mentor. Achal, you are there?
Yes, sir.
So after being the president of NMC, of course, he is also ENT surgeon and principal of medical colleges. And now he is the vice chancellor of Mahatma Gandhi University of Medical Sciences, Jaipur. Achal, I know you have a lot of opinion about integrated medicine. And what do you think is your thinking about it? And in what way you will like to establish this thing in your university?
Thank you, sir. I mean, actually, I was just traveling in the morning today and I got this message from Double Helical that there's this meeting. So I just thought, let me just participate in it listen to it and may widen my horizon of what I keep on doing the whole day, actually. So, sir, basically, I look at it this way, that when we look at the WHO's definition of health, physical, mental, social, emotional, spiritual. So when I look at all these aspects of health, now, if we are going in for an integrated medicine and this concept about integrated medicine, I think if all the 5 tenets of the WHO definition have to be taken in, then we have to resort to an integration amongst all these specialities and all these branches. Because कभी भी सर कहीं पे भी हम एक ही तरीके के ऊपर I cannot keep on going. Problem what happens is, as a human nature, one goes into a criticismal appraisal and not a critical appraisal of any organization or any science or anything, which is something which goes against the basic tenet of science, that we have to go with an open mind. कहीं पे भी कोई ये ऐसा वो नहीं है कि हम बिल्कुल एक ही तरीके से अगर हम उसको करते हैं. So if I look at again the definition, so I will look at the preventive, promotive, and curative health. Dr. Gyani mentioned very nicely about the promotive health. Now that is something which is very important, the promotive and the preventive health, and this is where we can take help of other systems also. whatever we are doing, sir, we still have to remain on the first basic premise of ethics of medical treatment, which is do no harm. So, kabhi bhi humko, jo bhi hum kare, we need to be based upon the evidence-based medicine and not on anecdotal medicine. It is very easy to say, sir, मैंने 1000 मरीज treat कर दिए, मैंने 10,000 कर दिए, मैंने 20,000 कर दिए. I have to have evidence base for that, and that is where the role of research which would come into the picture, the role of institutional ethics committees would come into the picture. So the integrated research projects which are there, if we go about it hand in hand, following the proper tenets of ethics research, ethical research, then I think we are in for a huge change in our entire attitude. Sir, मैं कभी भी कोई दवाई देता हूँ, I need to look at the adverse drug effects. I need to look at what is the content of the medicine. Am I looking at heavy metals in the medicine? So I need to just look at that evidence base as to is it causing any harm, because tenet of again would be do no harm, and that is where I would like to emphasize that my first principle of ethics would be there. Costs. Now India, sir, is a very cost sensitive market, and where we have to really go in for the costs of any situation. And today, with the corporate setup coming in, with the costs of the modern medicine or allopathic medicine going high, I think we need to go more into preventive and promotive aspects of health, and which is where again our systems would probably come up. So collaborative research following all ethical principles, if we can manage to do that, will really be a boon to this sort of a thing. So what I'm looking at is a complementary medicine. I'm looking at an integrated medicine, and something right for. Let me look at it, sir. In maybe if I go back, when the coronary artery bypass surgeries came in, the issues about rehabilitation of the individual or the promotive health of that, and the carry on post CABG rehabilitation program which were there, were really very successful across the country, and which were taken over by a globe across. Unfortunately, we did not take it in our country, but it got carried across the globe for those issues. So when we look at conventional healthcare and we look at complementary healthcare, we are in for a great future with us, provided all the new medicines which are introduced. It follows the four phases of drug trials and goes about it in a systematic scientific manner. And it is introduced, if I'm going to introduce a molecule in the market, it probably takes me 5 years, 10 years down as a research molecule to come into the market. But to suddenly come out and say, I produced a molecule which I have treated thousands and thousands of patients, and I've developed that molecule within 1 month or 15 days, somewhere down the line, that is where the public perception would change over there. And like Dr. Gyani was saying, again, the NMC has introduced also foundation course, which is there when any MBBS student enters. The first 15 days is a foundation course, whereby the awareness about the various systems is put into the minds of the new students who are coming. And also during the internship phase or during the training phase, he can take as an optional training course for 15 days. He may get, if he wants, he can get posted to these hospitals for being awareness over there. At no point of time can I call him a specialist in that just by attending 15 days of thing. But my main aim is that the awareness should spread across. And if that spread across, I think our purpose at the end of the day is served over here. I don't know whether you agree with me, everybody on the panel, all of you are experts. Dr. Agarwal sir, you have been my guide and mentor throughout. और जहाँ पे मैं आज हूँ, ये आपकी बहुत इसमें contribution रही है. And Gyani ji, I keep on meeting. He's on the board of management of the Mahatma Gandhi University. So I think sir's guidance over here is really going to be a big boon. Thank you so much for giving me this opportunity of talking, uninvited or invited, depending on how you look at it, into this panel.
It is fully invited. Right. Thank you very much, Dr. Gulati. I think, as Dr. Tanuja said, they had been a very good beginning. And that is, she gave the examples of All India Institute of Ayurveda, where the entire data of 27 lakh is supported by evidences and all. But this is the beginning. I must say that the research part, which in our country had been perhaps a missing link, but as per the government policy, as per the interest shown by the stakeholders like you and everybody in front of me, very soon we will be able to answer all the hurdles of integrating. It will take time. It will take time. Everybody is they are having their own strength. As I say, rather I say this is my strength, I must confess this is my weakness. The moment we are able to accept my weakness, our weakness, then let the other system invite, can you help me? And once we have this approach, one day we will be, India will lead. We want India. India is already leading, and we will lead for the entire globe. Now, I think, Dr. Tiwari, there are few questions which will be put by you to our panelists.
So the question goes to Dr. Nishari. This question from Mr. Kaushal from New Delhi. Can you please let us know impact of taking moringa drumstick? This is your drumstick plant to enhance or prevent the health conditions. Hello. 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 Are you getting me? Am I audible?
Tanuja
Am I
ji,
audible?
I think Tiwari ji, she was traveling by car.
No,
I can
no.
imagine.
Dr. Tuli can give the answer.
Yes, Dr. Tuli, drumsticks.
Yeah.
I'm very
Moringa.
fond of drumsticks.
Dr.
Tuli,
Tuli,
are you there? The only comment I can give, Tiwari ji, that after going through the literature of Moringa,
you can give, sir. Welcome.
eh, who is there? Dr. Tuli is there? The
Dr.
only
Tuli,
comment I can give after going through the literature and going through all the advantage of Moringa, only 15 days back, I have planted one Moringa tree in front of my house.
yes.
Good.
Any more question?
How does integrated medicine help in addressing chronic disease like diabetes, hypertension, or autoimmune disorders? Can you
So,
give the any experts?
Dr. Amitabh?
ये बेसिकली देखिए डायबिटीज और जो मॉडर्न डिजीज है नॉन कम्युनिकेबल डिजीज और ये ऑल दीज आर ड्यू टू द प्रेजेंट लाइफस्टाइल इंक्रीज इन सेडेंटरी लाइफ increase in fast food, ultra processed foods. And Ayurvedic and holistic medicine people are very, very particular about lifestyle, as all the speakers have given the benefit of yoga. So, yoga is a good physical activity or any physical activity that is promoted, daily, regular sleep, and even sleep improves immunity. Autoimmune disorders are due to lack of sleep, or immunity goes down with lack of sleep. And then your diet. Diet is very important. In fact, with physical activity, if you reduce your weight, if you take a healthy diet, the dose of anti-diabetics comes down. It is known in modern medicine also. All good endocrinologists will first stress on that. Similarly, for high blood pressure, if you reduce weight for every 10 kgs, your BP also comes down 20 mil for every kg of weight reduction. So these are these are already holistic, but due to the high pharma pressure, we are resorting to too much of pharmacological solutions, which can be by lifestyle, which can be tackled. And people are becoming passive also, because they would prefer, now the big market is coming for anti-obesity drugs. $1 million market is about to come. Without doing exercise, you will reduce weight. But those drugs can have side effects which we don't know in the long term. So definitely we have got a huge potential and a huge window of opportunity to promote this all holistic system of medicine, which will stress on lifestyle and less on pharmacological solutions. So I think this is something which is, I think, all practitioners of all systems of medicine will agree. Thank you.
A word,
Dr.
Thank you. Yes, yes, please.
Yes, I support Dr. Amitabh ji has mentioned about the sleep. But in whenever diabetic patients along with medication, either it may be Ayush or modern medicine, we advise for whenever they do some yoga practice, maybe asana, pranayam, or breathing, whatever it may be. There are many techniques. But when it is really a very good practice, it will bring the autonomous functions. Both the sympathetic, parasympathetic balance is very important. Though the second one is the quality of sleep. A lot of research has been done. Whenever we do 45 minutes of good yoga practice along with breathing and meditation, it improves the quality of sleep. Many people forget that in a diabetic patient or any non-communicable diseases, sleep plays an important role. So that is also the period of sleep between 10 to 4, that specific speed we operate. For that, we need the mental balance. So yoga practices are mind-centric. So we need to change the lifestyle. We by advice it is not possible, but it should be a practiced. So yoga is such a practice. It helps us to modulate our mind and our mental attitude has to be changed. Behavioral modification has to be occurred. There is a systematic procedures to bring the behavioral modifications in yoga. That's the one system. So that changes the lifestyle unless we change the lifestyle. Only medication will not help. Everybody agrees that. So that is to be done by the practice of yoga. That's my.
Thank you, Dr. Ishwar. I think it's a very, very valid information you have given. I think we are already overshooting the time. Tiwari ji?
The last time goes to Dr. Giridhar Gyani Sahab.
जी
Dr. Gyani Sahab.
जी बताएं.
The question is that, sir, how can integrated medicine be made more accessible and affordable to people who may not have the means to pursue alternative treatments? And what kind of awareness can be done in various societies around us?
देखिए, बहुत ही रिसेंटली हमने एक पेपर बनाया है जो कि हमने डॉक्टर विनोद पाल को सबमिट किया है, एंड कॉपी हैज गॉन टू द मिनिस्ट्री ऑफ हेल्थ आल्सो. आई थिंक आई विल शेयर दैट कॉपी विथ यू एंड प्रोफेसर अग्रवाल. उसमें जो मेन एम्फेसिस दिया है कि हम लोग अफोर्डेबिलिटी की तो बहुत बातें कर रहे हैं, लेकिन हमने ये दिखाया कि मेन इशू इज द एक्सेसिबिलिटी. इंडिया में सारी की सारी जो हेल्थ केयर है वो टीयर 1 में है, टर्शरी केयर, या फिर टीयर 2 में है. टीयर 3 में कुछ भी नहीं है. तो हमने एक मॉडल दिया है उसके अंदर कि हाउ एक्चुअली एक्सेसिबिलिटी कैन बी इम्प्रूव. And where, as I suggested earlier, we have suggested that few community health centers could be Ayush, few primary health centers could be Ayush, which are next door to the community, and that is the model. And usme, because government is not able to spend enough budgetary allocation, so we have suggested the incentives which can be given to the private sector for investing in tier 3 town and rural area, and which include, as I said, few community center, few primary health center on the Ayush. So I think this recommendation, even Vinod Paul has, actually he sent me the mail only yesterday, that he has appreciated our points, and let us see now how these are implemented.
Thank you.
सर, आपको ये नहीं लगता है कि आज जो हम लोग इंटीग्रेटेड मेडिसिन की बात कर रहे हैं उसमें जो हमारा एलोपैथिक विंग है वो बिल्कुल कंपटीशन के मोड में और किसी भी दूसरे अल्टरनेट मेडिसिन को पनपने नहीं दे रहा है? आप क्या कहना चाहेंगे?
नहीं, देखिए, अब ये वही कहावत है, हम उस लाइन को छोटा नहीं कर सकते, हमें अपनी छोटी लाइन को बड़ा करना है. एलोपैथिक इज एस्टेब्लिश्ड एंड दैट इज रिमेन, एंड वो एडवांस होती रहेगी, बहुत अच्छी काम कर रही है. हमें जो टिपिकल एडवांटेजेस हमारे अल्टरनेटिव मेडिसिन में है, हमने उनको बढ़ावा देने का है और उसको प्रमोट करना है. एंड दैट इज वेयर एक्चुअली मैं कहूँगा कि आयुष मिनिस्ट्री बनी इसलिए थी, अदरवाइज इट वाज पार्ट ऑफ द मेन मिनिस्ट्री. अभी अलग से मिनिस्ट्री बनी है तो अब ये उसका दायित्व है कि उसको हम कैसे बढ़ावा दें, एंड दैट बढ़ावा हैज टू बी थ्रू प्रोमोटिव. अभी अचल गुलाटी ने भी आपको बताया, प्रोमोटिव जब तक हम नहीं करेंगे, जब तक हम कम्युनिटी को जगाएंगे नहीं, डिमांड नहीं जनरेट करेंगे, तब तक कुछ नहीं होगा. तो अभी तो हमें कम्युनिटी में ही कॉन्फिडेंस लाना है, तो वो आई थिंक हमें काम करना है, एंड दैट इज द ओनली वे.
लास्ट एविडेंस बनाने के लिए क्या क्या स्टेप्स गवर्नमेंट को अभी इख्तियार करने पड़ेंगे? आपका क्या कहना है?
वो तो आई थिंक डॉक्टर अरुण अग्रवाल ने आपको बताया, प्रोफेसर तनुजा ने बताया, एंड
लेकिन
मैं कहूँगा कि फिर हाँ, तो ये आई थिंक अग्रवाल साहब आंसर करेंगे इसको।
आई थिंक तिवारी जी आपका कहना बिल्कुल ठीक है। जैसे कि हमारे पास एग्जाम्पल ऑल इंडिया इंस्टीट्यूट ऑफ आयुर्वेदा का है, ऐसे ही देर आर इंस्टीट्यूशंस ऑफ एमिनेंस जो कि इसमें लगे हुए हैं। समहाउ मेरे सामने इस समय डॉक्टर अचल गुलाटी भी बैठे हैं और उनके बोर्ड ऑफ डायरेक्टर डॉक्टर ज्ञानी भी बैठे हैं। तो इंस्टीट्यूशन लाइक योर यूनिवर्सिटी और एनी अदर university has to dedicate total efforts on this, right? We can expect it from a smaller hospital, but they have their own limitation. But any such institution where the academic and research is the integral part, if they can take a lead, perhaps in couple of years, we should be able to create more and more literature. And that is what I feel. I mean, like Murad Institute of Yoga, such an eminent institute for the country. The same way there are medical universities, like I gave you examples, all Indian institutes of medical sciences. There are 22 all Indian Institute of Medical Sciences. So all these institutes should get together, and our effort should be perhaps to create a common platform where we can always give some sort of I won't call it incentive, but perhaps we may have to promote the concept. And I'm glad each one of you who is in front of me is a key part of that promotive body. Please do it, and we will continue to do it. I think Tiwari ji, I think this is the time we are already completed. Thank you very much. Yes, a quick comment.
Yes,
Tiwari
one
ji, a
small.
quick comment.
Yes, Tiwari, only one thing. We started in 2008 in Advanced Center for Yoga Therapy and Research in Nimans, and like JIPMER and all the premier medical institutions in 2008 to 10. Now, all of them have a integrative medicine department. They have created the faculty in Nimans, and they have independent integrative medicines where yoga is the main part, and Ayurveda is also there. So not only in yoga center we have integrative or Ayurveda and integrative, but in modern medicines, premier medical institutions here in Delhi, in 5 medical institutions we have tertiary care yoga therapy integrative medicine centers. So like this in all the hospitals also, wherever it is evidence based, I agree with that. It's evidence based medicines. So that type of research is generated by the medical professionals is more acceptable, and that could be done by starting the not only providing the services but also starting the therapy with research. So we start with case reports and with a small center and multicentric studies. In my opinion, always I prefer multicentric studies is the future. So that will be more important. That is to be encouraged. I think Ganiji will agree with that.
Great, sir.
Thank you
Great.
very much. I think, Tiwari ji, allow me to thank all my panelists, esteemed panelists in front of me. Dr. Amitabh, thank you. Dr. Gyani, Dr. Ishwar, and Dr.
Tanuja.
Gulati,
Namaste.
Dr. Tuli, and I think I'm forgetting one more name. Dr. Tuli, are you there?
डॉक्टर
Of course,
तनुजा आ गई हैं।
we missed.
Online being. Thank you very much for all that.
Yes, thank you, Tanuja ji. I think I really wish that your institute and institute like, as we said, Dr. Achal Gulati, Mahatma Gandhi Institute, University of Medical, these are the places where one can have integration and one can always have some
Yes, sir.
sort of beginning of research. You are doing wonderful job. With these remarks, thank you very much.
Can I just come in for a minute, sir?
Yes.
I have an open invitation for everybody to have the next meeting at Jaipur, sir.
वाह
Thank you so very much. We'll be very happy.
That's good.
Thank you.
Thank you.
And you are
Bye
most
for
welcome Sir, 1 minute, may I come in for 1 minute?
Yes, yes,
We
madam.
have international conference on 17th, 18th, 19th October, and we also have our foundation day on 17th of October, and it is on the scientific research and advances in the integrative medicine. So I request yourself to be a part, and also please encourage the faculty and others to submit the research papers. And thank you, sir.
Thank you very much.
Thank you.
Definitely. Bye for now. Keep yourself
Thank
safe.
Good, sir. Grateful to all of you.
All the best.